Hi, my name is Dr. Busha Chowdhury and I'm a GP in Salford. This is our third video in our Covid-19 vaccine series. You can see the other parts and all of our videos translated into several languages over on our ASTOC YouTube channel. Dr. Abdul Manan, GP and ASTOC champion, is the vaccine safe?
Well, in short, I would say to you that the vaccine, the coronavirus COVID-19 vaccine, is safe. This has been found to be the case by the Medicines and Healthcare Products Regulatory Authority in the UK, in short MHRA. Now, of course, there are a few exceptions to the rule. For example, if you are pregnant, if you have a history of severe allergies, and if you do fall into these categories, then the chances are you will be asked to not have the vaccine and wait instead until a safer alternative is found. Now, the question then comes, has it been made too quickly? Who's it been made by? Is it safe in that sense? Well, first of all, who made the vaccine? Let's take the Oxford vaccine, for example, the Oxford AstraZeneca. The research capability was being provided by the Oxford University researchers. The manufacturing capacity was being provided by the AstraZeneca partners. The funding was being provided by a panel of organisations, not least the government and of course other charitable foundations. So these kind of funding streams come with a lot of strings attached, including scrutiny, and these strings make sure that things are done in the way we have set out to do. So the vaccine must be safe, must have been tested rigorously, and we know that for sure that the MHRA has been involved in part of the scrutiny from the start, not just looking at the vaccine once it has been made, but throughout the steps, throughout the various phases of trial. Now, in terms of speed, well, yes, there is some truth that under normal circumstances, drugs and vaccines do take a few months to deliberate, to go to panels, and then it takes years for it to be manufactured. However, in the last few decades, we are finding that because of improvements in communication, improvements in technology, it is becoming quicker to create medicines and vaccines. Now, not to forget, the technology behind creating these vaccines, this isn't new technology. In fact, we have been making vaccines against other strains of coronavirus for over 17 years now. We have simply used our existing knowledge, our existing abilities, and said, right, how can we solve a new problem ahead of us? Because of the kind of urgency behind creating a vaccine for the COVID-19 situation, it has meant that people have come together, collaborated a lot more efficiently, which means that stages that are delayed have been sped up much more so in order to facilitate creating a vaccine. So you can see that what might have took years can actually be done within months.
Dr. Samia Latif, Consultant in Communicable Disease Control, Association of Pakistani Physicians of Northern Europe. What is mRNA, and does the COVID vaccine alter your DNA?
The vaccination contains messenger RNA. When messenger RNA is injected into the body, it enters the cells and it makes the cell produce a harmless bit of the virus protein. Our bodies recognize this protein to be a foreign body and produce antibodies to this foreign body. And that is how we get our immunity to COVID infection. The messenger RNA dissolves in a few hours and it does not enter the core of our cells, so it does not change the DNA of our cells.